Why I became an independent Medicare insurance broker. Hi, I'm Bill Lewkowski, and in this video, I just want to introduce myself, tell you a little bit about my background and why I am now an independent Medicare insurance broker. So I spent over 40 years as a healthcare executive working for hospitals and health systems. But during this time, I also had two aging parents that, as the eldest in the siblings of the family, I was there as the power of attorney to help take care of them. And so I learned about Medicare and what seniors are faced with and some of the confusion and some of the misinformation that sometimes comes their way. And so as taking care of my parents and seeing this, I actually experienced two different paths for Medicare as an example of my parents. My dad was on original Medicare, and he had what was called a Plan F for a Medigap or a Medicare supplement policy. His healthcare was very comprehensive, and it really took good care of him. He was a diabetic and had other issues and other conditions that needed a lot of attention, and his Medicare and his supplement combined was just a great comprehensive solution for him. Now, my mother, on the other hand, somehow got Medicare Advantage, and there is a story there. I don't really want to go into that, but because she got onto Medicare Advantage before I was involved with learning about this and helping to work with them and guide them, she got on Medicare Advantage and she could not get off. And the reason for that is she has a couple conditions, mainly congestive heart failure and AFib, along with a few other things. And so she was really with Medicare Advantage. She's still with us. My dad passed several years ago, but my mom is still with us. But right now, her Medicare Advantage policy, although there's a lot of good to it, it's becoming very expensive with a lot of the out-of-pocket expense in and out of hospitals, tests, doctors, just a number of things that are really starting to really drain her savings and ability to cover her health care. So I saw this example of two different paths that you can take with Medicare, and I decided that in my later season of life, I wanted to do something much more meaningful that's dedicated to taking care of seniors. And so I took the path of becoming a licensed independent Medicare insurance broker so that I can help be an advocate for our seniors. I want to make sure that they're seeking someone that can really help guide them, as opposed to some of the call centers and other people that tend to be calling and preying, I call it, on seniors, some with good intentions, but many potentially only telling part of the story and maybe not 100% looking out for the best interests of the seniors. So as an independent Medicare broker, that's what you can do. You're there for the senior. You're there to help them, guide them, understand anything that's going on, that's changing every year, and how can you be there as a lifelong advocate for the senior. And by the way, independent Medicare insurance brokers are free. The services are free to the seniors. The way we get compensated is actually through the insurance carriers. And it really, if you went with a broker or if you went directly with the insurance carrier, the rates for your Medicare plans would be the same. So that's something that a lot of people don't understand, is that Medicare brokers are free to you, but they can offer many of the options. I do carry over 30 insurance carriers, and I do have all the major carriers, so I can bring all of the options. But what I'm really there for is the advocate for the senior, to help them find the best solution for them. So my advice is to seek out the free services of an independent Medicare insurance broker who you can get to know and trust, and someone that will be there not just a one-time, but for a lifetime to help take care of your needs.